You can
Hello,
start.
Farouk. If you could introduce yourself, tell us a little bit about what you do, your specialty, your private practice, how long you've been practicing.
First of all, thank you so much, Sohani, for giving me this opportunity to talk about telehealth today. And I'm Dr. Omar Farouk. I practice internal medicine in Bensalem, Pennsylvania. So I've been practicing for almost 20 years now.
Oh, wow.
So I came from Pakistan in 1991. I did my residency. And after that, 1999, I started my practice in Bensalem. So I'm specialized in internal medicine, primary care
Mhm.
physician, you call us.
Yes.
So that's what I do.
Mhm. Um, so how did you get into private practice?
That's a very good question. I thought that going into private practice and there's a better way I can serve the community. So, sorry, sorry, my phone. And I think that that's why, I mean, we need a primary care physician. The primary care is the backbone of medicine.
Mhm.
So we are the one who see the patient. We are the first line doctors. So I think it's very important. So that keeping that in my mind, so I came into primary care, primary care, so I can have a first right way encounter with the patient, so I can help them.
Um, so we are in the midst of a pandemic, and during these times, we have seen an increase in the use of telehealth. So I wanted to ask you how you've been using telehealth in your practice, and how the pandemic has kind of changed how you practice medicine and how you've been incorporating telehealth. And do you think it's been effective in providing patient care?
Yeah, of course, yeah. So first of all, when the pandemic started, so we got very nervous. How are we going to see the patient? The
Mhm.
telemedicine is there forever, but we have not used it. The reason is we have not used it because there are so many things you need to do telemedicine. And basically, you need a third party in the middle. Somebody has to go to patient's home, and we have to have encounter face to face, and we had to do the physical exam. So all these things were really a little bit complicated. But when this pandemic started, we have no option left. So at that point, okay, let's go with the telemedicine because we can't see patient in our office because they're sick and they're COVID-19. So there's no practical way to bring them to the office. So that's where we started, and it came up to be a very good experience. So I started to like it because number one, we're talking to the patient in this kind of situation when they cannot leave the home, and they felt that they're being taken care of by the doctors, and we were doing like either by the FaceTime or we were just making a call. So both way was acceptable by the insurance companies.
Okay.
So that really helped us. I mean, a lot of patients, they just need their medication refill. They don't have to come to the office. They don't have to expose themselves. So that was a good thing. And they have minor issues and we can solve on the phone, on the telemedicine. So that was really a blessing. Telemedicine is a blessing. Now I think it is a blessing, and the future of telemedicine is there now. So it's just started, and we have experience in it, experience, and a lot of patients are elderly patients. They can't leave the home. They have to come to the office. They're in wheelchair. So many things we can talk to them on the phone, and we can do a lot of things just on the phone or on the telemedicine.
Mhm.
So the telemedicine is not going anywhere now. So it's going to stay for the future.
Yeah,
And
definitely.
and on top of that, actually telemedicine, like we doing in United States, now we can do even abroad. I did telemedicine abroad too. So people call me, they want some opinion, so I gave them my opinion. So on telemedicine. So this is like the future of medicine. I will call it is the telemedicine.
So where do you see the future of telehealth going? Do you see it being more commonly used, now that we've been through a pandemic? And how do you think it'll be used? Do you think what are some positive and negative impacts that you think it can have on healthcare and especially in primary care?
I said that, as I said, future is the future. The telemedicine future is very bright. It's very convenient for the patient, for the physician as well. But of course, like there's certain thing that we can do, like we cannot do the physical exam. Even the patient is on, we're doing virtual on the FaceTime or whichever mean we use. We cannot do the physical exam. We cannot listen their heart. We cannot listen their lungs. We cannot palpate their abdomen. So all these things, we cannot look into their like eyes or throat really good. So that is the only little bit caveat that we cannot do that part of the physical exam. But on the other side, we can do like we can look at the patient and we can examine them just by the visual exam. We can look into the on their face. We can look into the throat as well. We can look into their chest and abdomen. We can look on their legs. So inspection part we can do, and sometimes that is enough unless they have some special thing going on where we have to listen their heart and lungs and we have to check their stomach, abdomen. So this is a little bit caveat. But to like make it more valuable, then again we're going to need something that we can listen their heart and their lungs. How can we do it? So there's a one way is a nurse go to their home and she can examine the patient. The nurse can examine. We can ask them, okay, listen the lung. So she can listen the lung and check the abdomen and can tell us what are the findings. The other way of doing through the telemedicine, there are some apps are coming. Hopefully they come soon. So we can listen their heart and their lungs remotely. Just personally, I don't like middlemen. I don't like. I just like my contact with the patient directly. I don't want anybody in the middle. So we need that kind of sophistication and advancement that we don't have a middleman. We have some kind of app, so I can listen their heart and lungs, and that can take their blood pressure. Patient can take their own blood pressure, and they can tell us, and they can check their weight. They can tell us. So these are the thing that I'm looking in future. Something come up with some kind of apps that can help us to examine the patient. Yep.
It was really nice speaking with you today, Dr. Farouk. Thank you so much for doing this.
No, it's my pleasure, and good luck, Sonny. Good luck, and take care of yourself. And what I talk about, look into the apps. All these young people, please come on, look into more, do some research. How can we make certain things easy for the telemedicine? Telemedicine is a perfect future, and I love it myself. I could not have done it if there was no pandemic. I could not have done it because there's new thing. It's hard to adopt.
Yeah.
But now, so a lot of doctors they already have adopted it. So thank you so much, and for the interview, and good luck.
You too.